there are some good supplements that are legal, things like Tonga Ali, Fidogia agressus, they can boost testosterone, and that people get benefit from, and don't shut down your own testosterone production or growth hormone production. Then there are drugs, prescription drugs, like growth hormone, testosterone, that people use for testosterone replacement therapy, and then just all-out steroids like Anadrol, oxandrolone, where like you see the guys, you know the look. And that can be abused, et cetera. Any of those things can be abused. But there's this new kind of wedge in between supplements and prescription drugs that are called peptides. And there are a bunch of different kinds. And the ones that are most popular right now in health and fitness, males and females, are, for instance, things that stimulate the release of growth hormone. They're called secretagogues. It sounds like synagogue, but it's secretagogue. Things like sermorelin, tesamorelin, ipamorelin. You take it as an injection, and they're taken before sleep. If you haven't eaten anything for a couple of hours, they stimulate massive growth hormone release, IGF-1, et cetera. They help you recover faster, fat loss, muscle repair. They also stimulate libido pretty substantially.
Whoa. This is a miracle.
Yeah.
What is this?
Sermorelin.
Why are we not on?
One, to get it really good sermorelin, you need a prescription, but there are a lot of doctors that will prescribe it.
Can work on that?
Yeah.
What if I'm trying to have a baby? Does it fuck that up?
It does not disrupt. So testosterone will disrupt sperm production. You can offset that. So let's say you were to take testosterone. It would shut down your own sperm production. Testicles shrink. But some people will take HCG, human chorionic gonadotropin. That can stimulate the testes to continue to make sperm. HCG, incidentally, used to be, now they make it in a laboratory, you inject it, used to be collected from pregnant women's urine. So in the bodybuilding community, people used to literally like try and drink pregnant women's urine. There was a black market for it. Yeah, I knew that. Yeah. Sermorelin will not disrupt fertility. Why wouldn't you take it? Okay, well, there is this issue that, first of all, you need a prescription to get it clean. Yeah, I've used sermorelin before. I actually listen, I'm really open about this because I never want to be like a natty or not video on me. I'll just say like not, I mean, not meaning I take sermorelin about 3 or 5 nights a week. Helps me get into really deep sleep quickly. You get a bit of a IGF-1 boost. It's great. You recover fast. I never recovered very quickly from exercise. Yeah. I didn't start until I was 45.
You look great now. You look like what I thought Lance Armstrong would look like with the steroids. You look like what he should look like.
I ride a bicycle, but not like him.
No.
So sermorelin
we should all get on this. What is the
the downside is it causes growth of all things, right? So if you have, for instance, a small cancer growing on your pancreas, it will accelerate growth of that cancer. So you tend to want to cycle these things to infrequent use, 5 nights a week or 3 nights a week or occasional use. Look, I'll tell you right now, a lot of the bodies you see in Hollywood films are on peptides.
Have to be.
Because right now the look isn't really super huge, a la like 80s professional wrestling.
Yeah.
The women are a little bit leaner and stronger than in past years. The men are sort of in that middle range. Yep. It's more about definition and, okay. Sermorelin. Then there's also something called BPC 157, which is actually based on a gastric peptide. Turns out that there's a gastric peptide that we all make that can promote healing of tissues. And I've talked to Joe a lot about this. There's not a lot of data on this, whereas there are a lot of data on sermorelin. But BPC, like I had an L5 compression and I was always like in pain standing up from a dumb thing. I don't deadlift anymore. I just made a dumb mistake. Massage, heat therapy, electric therapy, the whole thing. 2 injections of BPC 157. Look, if it was placebo, okay, I'll take it. Gone. Gone. The BPC 157 is remarkable. A few years ago, a guy tore his Achilles right before the Olympics, came back. BPC 157 was implicated in that. So again, you want to get good, clean sources. There are physicians that will prescribe these. Again, these aren't going to shut down fertility or testosterone production. So there's sermorelin, there's BPC 157, and then there's this whole landscape now of like TB 500, et cetera. There's a lot of kind of cocktails of peptides. Now, as long as we're having this discussion, and because of this audience, I have to assume has heard of TRT and testosterone replacement. There's a lot evolving there. I'm hearing about guys going on really young. I really worry about that because it will shut down your sperm production unless you won't be able to conceive kids unless you're doing something to offset that, like taking HCG. And that should always be done with a doctor. The new way of doing this is not to get 1 shot every 2 weeks of massive testosterone, but taking smaller doses every 3rd or 4th day. That's very common. But TRT, the R is replacement therapy. And the range of testosterone is really broad. And what I think guys should do is, I started weight training when I was 16. I was running and weight training. And then when I got to Santa Barbara, I was more like weight training and hanging out a bit. And then I got serious about studies. But the point is that you want to train on your own hormones, learn good sleep, good nutrition, good habits, and also live your life, right? You're not going to like not have a beer or two every once in a while at age 22 just because you might not recover as well. Like,
right.
You know, let's live your life is my stance. But once you have all those things in place, let's say you already have kids and people are feeling tired and more sluggish, then testosterone replacement therapy can make sense for some people. The problem is a lot of people think if a little is good, more is better.
And that's
not good. And also it's what you do with that. You still have to run, eat well, you know, preserve your cardiovascular health.
Yeah, it doesn't replace those things.
You still need blood work to make sure your prostate antigens aren't going crazy and stuff like that.
Yeah.
I hear about young guys who are just like, you know, they're slamming Viagra and testosterone. It's like this and that's not going to play out very well over time.
Right.
Like see what you can do naturally with hard work and dedication and balance.
Yeah.
And then over time you can explore things. But the peptides are interesting. They're kind of a middle ground where you're not risking as much in terms of long-term fertility issues. Mm-hmm. Women are using them a lot more now because they're milder. They don't have these so-called androgenic effects. They're not going to deepen the voice. They're not going to create facial hair for women, that kind of thing. But yeah, they certainly work. They're banned in sports for a reason. You know, there's a runner who ran for Stanford, I think still holds the American record for marathon, for fastest U.S. marathon, Ryan Hall. He was like a stick, finished running, got out, started lifting weights. He's a beast. Looks like something out of a Marvel movie.
Really?
Mostly because he's just eating and deadlifting and squatting now. He still runs a little bit, but he's not running gazillion miles a week. So
Look,
the peptides are interesting, but make sure you get a clean source. There's some good sources like TaylorMade. You need a prescription is a good pharmacy for peptides. These are clean. But I do take Sermorelin about 3 to 4 nights a week. You can't take it every night because it has less of an effect.